My name's Janet. I'm 53 years old and I work for a state agency in Illinois. 20 years ago, I was diagnosed with carpal tunnel syndrome in both my hands. I had small children at the time and I knew that I could only do surgery on one of them. So I chose my right hand because I am right-handed. And they cut my entire palm open to be able to do the surgery, the carpal tunnel surgery. I was off work for over 2 weeks. It was very painful. I lost a lot of strength in that hand, being able to grip. It took months to be able to open a jar because I'd lost so much strength in the hand. And that really put me off on having surgery on my left hand because I didn't want to go through that again. Then I actually saw a post on Facebook that Dr. Cobb was offering screenings for new invasive carpal tunnel surgery. And my hand had been starting to bother me a lot more. My left hand would wake me up at night. I couldn't sleep, more numbness and tingling when I was holding the phone. I'm like, all right, I've got to give this a shot now and be brave. So I came to see him. He agreed I was a good candidate, scheduled the surgery. I had the surgery on a Thursday afternoon. My husband and I left the next day on Friday to drive to Wisconsin for a wedding, and I was back to work on Tuesday. I was able to resume typing, even with my hand wrapped up. Stitches came out, the wrapping came off. I didn't experience the lack of strength and being able to grip. I haven't had to wear the brace since then. It's amazing the difference in between the two surgeries and the recovery time. And I would recommend the invasive surgery to anyone that was looking at it. Since my surgery, I haven't experienced any more symptoms. I don't get the numbness or the tingling when I'm holding the phone. My hand, I've not been woken up at night in pain. When I came back to see Dr. Cobb with the follow-up, I was like, I kind of feel bad getting rid of my brace I've wore. It's been part of me for 20 years. And it was weird sleeping without it. And I told him I was going to have a bonfire and burn my brace because it was amazing. I didn't need it anymore. I could highly recommend this non-invasive carpal tunnel surgery with Dr. Cobb to anyone that's experienced these symptoms. I put it off because I didn't want to go through that surgery again. And I'd been thinking about it for probably about a year because the numbness was getting more and the tingling and the pain at night. And it was the post on Facebook. And I looked at it and I stalled a couple of more weeks and it's like, don't be silly, call. And it was amazing. It was one of the best choices I've made in a long time.